These are the 5 mistakes that you need to avoid at the start of your AMC clinical stations. Number 1, if you look at the clinical handbook, you'll be provided with a stem and then there's a patient's name. It's important for you to remember your patient's name and remember it correctly. Next, number 2, make sure that you are not anxious at the start of the station. The first 30 to 40 seconds are usually the most stressful and the anxious time of the station. So make sure that you are relaxed and composed. Also, make sure that you do not catch your patient's anxiety, as in some of the stations, you can see the clinical handbook, the patient is asked to be anxious and worried and concerned about his health. Number 3, make sure you know how are you going to start the station, which means you can either start with an open-ended station, how can I help you, a closed-ended, I can see that you have pain, can you tell me where exactly the pain is, or a semi-open-ended, which is I can see that you have pain, can you tell me more about the pain. I'll make another video talking about it in details, but you have to be sure how are you going to start the station, open, semi-open or closed-ended. Number 4, make sure that you do not spend more than 30 seconds into the start of the station and you dive right into the diagnostic formulation part of the station as soon as you're done. But at the same time, do not hurry. Make sure that your patient is hemodynamically stable. Make sure that you have done your name and age verification to make sure it's the right patient, and make sure that you have addressed their concern. Number 5 is remembering the storyline. If you look at the AMC clinical handbook, you will see that you're provided with a story and there's a point after which you come in. Let's say that the patient came for a headache last week, you did some blood tests and he is here for his follow-up visit. So you need to know that it's the second visit that the patient is here, and you need to know that this is where the story is now starting.